What you see here is a scaphoid bone. It is a boat-shaped bone, one of the carpal bones, a boat-shaped bone. You can make out the shape of the boat here with a proximal part and a distal part, and separated by what we call as the waist of the scaphoid. Now, here is a radial artery coming to supply the scaphoid. There are two branches mainly. This is the palmar branch, which is directly going to the distal part, supplying the distal part. Other one is the dorsal branch, which is the major branch, which supplies almost the 80% of the scaphoid. Here you can see it is giving a branch again directly to the distal part. So the distal part is nourished by both the palmar as well as the distal branch, the dorsal branch. Now the dorsal branch is again winding and it is taking a recurrent course. Again it is cruising along the distal pole, crossing the waist, then coming to the proximal part. So that means there is no direct blood supply to the proximal part. The issue is if a fracture happens, which is very common in this aspect, in the waist of the scaphoid, there is literally a lack of blood supply to the proximal part, which will lead to a condition called the avascular necrosis of the scaphoid, which is a notorious fraction for malunion or non-union, or it can also cause avascular necrosis. Thank you.